Hello, my name is Dr. Daniel Stillwell. I am the IFTA e-newsletter editor, and today we have with us Dr. Rikki Patton, Associate Professor at University of Akron's School of Social Work, and Dr. Jessica Chou, Assistant Professor at the Department of Counseling and Family Therapy at Drexel University. So Akron's in Ohio and Drexel's in Pennsylvania, for those of you not familiar with the schools in the States. So today we're going to talk about a project that they have been working on for a few years. They got to present it at the most recent IFTA conference in Puerto Rico. And the project, which was funded at $1.3 million, so pretty legit, is called the Interdisciplinary Training Interdisciplinary Training Initiative for Children, Adolescents, and Families Impacted by Opioid Use Disorder. So welcome.
Thank you.
Thank you.
So to start us off, I just want to have you able to introduce yourselves, what you do clinically, because we have people from all over the world. So what kind of mental health practitioner do you identify as, and what does that look like where you work?
Rikki, you want to start?
I'd be happy to. So I'm licensed as a marriage and family therapist with supervision designation in my state here. I practice part-time clinically because I am a faculty, but my clinical practice really is focused on systemic practice with individuals, couples, and families who are impacted by substance use disorder in some way. So a big part of my practice are adolescents who are engaging in risky behaviors, substance use behaviors, and whose parents are freaking out about it, or even couples who have entered into early recovery or trying to figure out what does it mean to be a couple in recovery since they are healing together, both individually and relationally. So a lot of my practice revolves around that.
All right. And I am licensed as a professional counselor and as a family therapist. I'm also an approved supervisor for family therapy. I'm not currently clinically active, but most of my clinical work has really been within substance use treatment centers. So that's why Dr. Patton and I connected and have been collaborating over the years. We both share a passion for substance use in families. The clinical work that I was doing in treatment centers really revolved around gender specific treatment. So focusing on women and families impacted by substance use, supporting women and mothers. So understanding parenting practices and parenting education, also working with the whole family system when possible during treatment. I think, a lot of the focus is on individuals. However, we know that substance use impacts the whole family. And so we're looking at the ways that the family can be in recovery together and the longevity of that. So that's been most of my clinical work.
Okay, thank you. Yes, and I think you just transitioned nicely into our sort of main topic is what does effective family systems care look like when severe addictions are present, like opioid use?
Jess, do you want to start this one?
I can, yeah, sure. So I think that's a big question, right? So I think any kind of family support, I think, is a place to start. I think the hard part about families in substance use disorder is getting, one of the challenges is getting families engaged. So I think for me, anytime the family can get engaged, we'll take it. And so I think there have been a lot of evidence-based models for adolescents and parent-child dyads. I think we have a little bit less for adult families. However, we know that family therapy is effective in treatment. So, I think research has indicated that from treatment engagement to recovery outcomes, family therapy works. I think it's, the challenges remain about getting family involved, and then specifically what that looks like. And my lens, again, is really within the treatment centers. And so that's kind of been the focus. So I think in terms of effective, I think it's there. We have a lot. We have, structural, we have solution focused, we have all of these great family therapy models that we can use. I think it's that, the frequency at which we use them and the opportunities for people to get trained in them with families and substance use are some of the challenges with that.
I would I would add to what Jess shared, or thinking about some of the qualities that we want as clinicians to really model for the families that we're working with, and for the trainees that we're working with, right? So with family systems that are impacted by substance use disorder, I think compassion is primary, it's priority, being able to hold a space of compassion, and also curiosity. There's huge stigma and bias surrounding substance use disorders, which is another challenge to training clinicians and to working with families and getting families engaged. But being able to be curious without judgment, hold that non-judgmental stance, being able to collaborate with the family, knowing that they hold the expertise in their lives, and being a guide for them, because a lot of times they feel lost in the process. Entering into recovery is it's a grief cycle in a lot of ways. So being able to provide some guidance and patience. Therapy doesn't go exactly how you want it to, like ever. But especially when we're talking about families who are experiencing substance use disorder or entering into recovery, everyone's journey is their own unique kind of journey. And as clinicians, we have to be patient in the process.
Okay. And can you dig a little bit deeper into how do we want to get families more engaged? I know, Jessica, you said that any engagement is better than none, but what patterns or tactics have you found that seem to work?
So that's a great question. I mean, I think that's part of what Rikki and I are also working on, clinically and from a research perspective is, I don't know that we have a lot of protocols for specific to engaging family members. I know, I think part of this is, I think we have treatment teams and even clients who are doing really, really great work, right? So, I don't think as the therapist, I even necessarily need to be recruiting or reaching out and outreaching for family members. I think clients do a really great job. I think we have treatment teams and family therapists in centers doing a really good job. I think for me, it's the lack of dissemination of that information that can be really challenging. So it's not to say that it's not happening. I think it's just not being widely disseminated in some ways.
Okay.
I would agree with that, definitely, in the sense of having a better understanding of what currently is working out in the real world, for sure, would be a great benefit to our profession. In addition to that, recognizing the importance of the entire treatment team, which, as Jess already pointed out, that includes the patient, it includes the family members, and it would include peer support in addition to the professional providers. Thinking more integrated care.
Well, especially as the family systems models have done a medium good job recently going beyond, family of origin as the only support people in these people's lives. Family of creation, family of choice, that certainly is a major part of this as well. Now, both of you are at training you're doing this as training elements as well. You're both professors and you have students and you have supervisees. What are some specific challenges to getting people not only to see the world of addictions in this way, but supporting them along their journeys?
I think there are several things that come to mind for me regarding challenges, and this one probably resonates for most folks who hear it. Is one is imposter syndrome and working with families impacted by substance use disorders. This isn't a population that I can work with. I don't know enough, or I haven't been trained enough. I think that's a big one that we talk a lot about with our trainees regarding understanding substance use not as this big scary monster out there, but part of the systemic process and part of the system, part of the treatment. And that relates to also, I mentioned stigma and bias. I think stigma and bias is a big one, not just for our clients, but also for trainees, also for us, right? So doing a lot of critical reflexivity, self-reflection to really challenge our own understanding of stigma, our understanding of substance use, any biases that we carry, which relates to self of the therapist issues. And we have to infuse that into the training that we do to help us, to help trainees understand where are the biases that they hold and how to address them The last thing I'll add, and then I'll hand it back over to Jess, is the disconnect, and I'm sure Jess will speak to this, the disconnect between family therapy and substance use, especially regarding research and systematic research, evidence-based practice beyond adolescent models or parent-child models. There's not a ton out there. So I think that that leads us with little to lean on regarding developing training models.
Yeah, I would agree with everything Rikki said. I think one caveat to the last question that we answered that I want to highlight that also kind of leads to this is, I don't think it's also that, I don't want to make a wide generalization that no families want to participate in treatment, right? I think we actually have a lot of families who want to participate in treatment. I think part of it is they don't know how to engage, how to interact, how to communicate. And I think that also speaks to potential gaps in the workforce development on how we can educate family members who want to participate. So I wanted to clarify that because I think I've worked with a lot of family members who want to engage and want to support, and they don't know how. And so I think, I think what a lot of what Rikki and I also have focused on is, I think my soapbox, I won't get into it, but we're really well trained as family therapists. We are systemic thinkers, right? And I think for a problem as complex as substance use, you have to be thinking systemically about this. I think where the gap is we aren't really trained in substance use. And so we understand systems, we understand the relationship between systems, but when it comes to content specific to substance use, I don't think we get a lot of training and a lot of exposure. And I also think that leads to, some biases and stigma, right? Because we just don't have the exposure for it. And so that was a huge, huge driver for this program that we developed of, I think we understand the limitations of being able to, add to curriculum that's already packed and make sure we're, making it's with accreditation standards and things like that. We just can't be adding all of these classes. And, are there ways that we can provide supplemental training to family therapists so they have exposure to substance use? Because, I think a lot of the conversations that we have with our trainees is, substance use work is also trauma work. And it's also inevitable. And so I think those are kind of the conversations that we have that I think have helped with some of these barriers. But I just think access to training specifically for family therapists has been a bit of a barrier at times.
Okay. Yes. In the states, we have a licensed clinical addiction specialist in many states. But outside the states, the idea of getting a second license specialized only in addiction stuff is often beyond what the infrastructures allow. Are there resources or even books that you would point somebody to just if they wanted to start dipping their toe into this type of thing?
Absolutely. And you mean for like family therapists? Because I think the other thing that, we talk a lot about too is the, interdisciplinary teams and how important that is. And how, I think there are, peer recovery support specialists who also do great family work. So I think for us, it's kind of how can we bridge some of these fields together and maximize on this knowledge and the great work that's already being done, right? So I think it's how can we support family therapists in maybe substance use training, and also how can we support those who are already doing great work in the substance use field and provide them maybe with some family therapy or family support or family training. I think that's kind of the bridge that we're always trying to do. And so for me, I think SAMHSA has the their TIP protocols. They have a lot of they have some on trauma-informed care. They have some on including family and treatment. There's a book in our field. I am blanking on the name. I don't know, Rikki.
Substance abuse in the family.
Families, yeah. So that's
by Michael Reiter.
Yes, so that's one I think kind of the core one that we've used. I don't know, Rikki, if other resources are coming to mind.
The ones that you listed, just primarily, I'd start with SAMHSA tip series for sure. I know that
and for those listening, SAMHSA is SAMHSA because it's a group here in a governmental group in the US.
It definitely blends. Thank you, Daniel. I think NIH has some resources online with the National Institute of Drug Abuse and NIAAA. There's some resources online there. I think starting with that text and diving into some of if you can do that, read the academic journals, diving into some of the substance use journals to see what's being done out there in the intersection of family. It's a good starting place.
Okay, yes, because we do have an international audience. And so being able to find different avenues to support them, to bolster their work is always important, especially when we have people who know what they're talking about right here. So I guess last question, we'll just build on that. Are there other aspects of this that you think could be generalized or extrapolated to people around the world?
Absolutely. I think, unfortunately, substance use, with the high prevalence rates of substance use, right? There's just for us in the United States, I think it's inevitable that we're going to be working with families impacted by substance use. However, I think that extends globally as well, right? In terms of, I think both, there's things that we can learn from, like internationally, from other places who are doing really great substance use work, and perhaps taking different angles, as well as I think there are things that we do here in the United States that could also be could be translated and applied internationally. So I think it's kind of a bi-directional in that I think we have things that we can learn, but potentially things that we can offer. But I think substance use is an international, global epidemic, right? And so I think that I think the more people working towards it, I think the better.
I agree with those points. As just highlighted, substance use impacts families across the globe. I think part of one of our hopes for the ITI program is to develop it so that it can be available for clinicians, trainees to access. And it would be wonderful to reach beyond our states of Ohio and Pennsylvania, across the nation and across the globe, and even start getting some feedback about how could we tailor ITI so that it is addressing not just what our trainees here need, but to make it a more universal training that's helping again across the globe, so that we all can help families who are impacted by it.
Okay. It sounds like some of this really is going back to the basics of awareness, not necessarily, even if you're scared, bravely stepping into these different spaces, recognizing that it isn't that sort of other monster that I'm not ready to deal with type of thing. Yeah, I think that when I talk to people about eating disorders and substance use issues, because there's also sometimes the physical medical piece, it can feel overwhelming, but it doesn't mean that there isn't a space for us on those interdisciplinary teams working with the other people involved, recognizing that addiction is a family issue. So good work. I am certainly looking forward to seeing what your initiative and other people working with you develop, and maybe even give us a little, like you said, a training module or something that we can follow in terms of best practices and whatnot. So thank you both for being here today and sharing with us some of your work.
Thanks, Daniel.
Thank you.